Okay, we're on. My name is Robert Mendelson, and I'm part of this duo for today. Welcome, everyone. I am a professor of psychology at the Derner Institute of Psychology of Adelphi University, New York. And I've been previously a dean at Derner, and now for many years, a faculty member, actually 48 years, but who's counting? And I'm delighted to introduce my co-participant today, one of my former students, Dr. Peter Caproni. Pete?
Good afternoon, and thank you for joining us, folks. As Bob said, I'm a very proud graduate of the Derner Institute at Adelphi University. Spent some time in New York before coming down Florida way. I'm speaking to you from Fort Lauderdale now. I am core faculty for our school psychology doctoral program here at NSU, Nova Southeastern University. Do a couple other things here at Nova, including serving as the supervising school psychologist for NSU University School, and I'm the director of training for our postdoctoral residency here at NSU. So in my spare time, I like to travel, cook, and play a little amateur guitar. In terms of background, I'm trained as a school and clinical psychologist, so I'm certified school licensed psychologist, and I had the opportunity to talk to Bob just before COVID set in. He did a very nice CE for us here about one of his books in terms of doing marital therapy. And since that time, we got to chatting. And one of the things we chatted about is how this pandemic has impacted our work as psychologists in terms of ourselves, our families, our clients, our students, etc. So we kind of came up with the idea of having a conversation here about this, and hopefully to get some participation from all of you, as I'm noticing, from all over the country. So it's very exciting to see a lot of people, joining us. This is, we welcome folks who are non-mental health practitioners for this discussion, but we are focusing mostly on practicing practitioners, clinicians, and those who are in training to become clinicians. So we decided to forego the ubiquitous PowerPoint in favor of a more relaxed kind of setting and discussion back and forth, since that kind of fits both Bob and my personalities. And I'm going to give you a quick roadmap of some of the topics we're going to get into today. So we're going to begin, as I said, by talking about how the global pandemic has impacted clinical work, how the pandemic has impacted our own self-care as clinicians, how we can build our self-care capacity, and we're going to have a little exercise in there to kind of demonstrate that. And the most difficult thing, and this is something I'm going to hope for some help from you guys, is how do we maintain an optimistic perspective for today and tomorrow in terms of our work as clinicians. So one of the things that we've all heard is how doctors make the worst patients. And this is true during normal times, but certainly the last 2.5 years are not normal times. Consequently, the risk of our neglecting our own self-care is even more pronounced in these extraordinary times. So let's take a look at some of the changes that may impact our stress level, as well as how to enhance our current self-care practices. And Bob, feel free to break in here at any moment. I'm going to start to go through our notes. One of the things we talked about is how many of us overnight found out how to do telehealth, particularly those of us in private practice, those of us who are instructors and professors at universities. I had never touched Zoom prior to COVID. So this is something that we all had a steep learning curve. And steep learning curves are stressful. So that was something that increased our stresses. Also, in doing clinical work via telehealth, we have attenuated nonverbal communication. We've got a two-dimensional kind of screen there. It's not the same as being in the room with a person where you can see and touch. It complicates our getting to know our clients. It complicates our assessing risk. And it also alters boundaries, for good and for bad. Our cat running through the room, their kid running through the room, et cetera, et cetera. Or sometimes even determining who else might be in the room. We're assuming that it's our client, but sometimes that's not the case. I think one of the other stress factors that we were just talking about prior to the start is how, for those of you in private practice with a group, probably came to rely on that group as a support, both socially and professionally, and as an antidote to some of the isolation that comes sometimes for us in private practice. Suddenly, you're at home and you're not in the office with your group, and so that again, is a stressor.
I would like to add something about the two-dimensional Zoom versus interpersonal. In my work, sometimes where a person sits, because they have several choices, or how close to me or far away they sit in the first meeting, is very telling. Sometimes to make a point and see issues of boundaries, I'll move closer to someone. And if it makes them anxious, it's data I'm going to use. So we are deprived of, on the one hand, I had the advantage of working with a family. One is in one state, another is in the Pacific Coast, et cetera, et cetera. We can do that with Zoom, which is probably going to remain as a treatment option, forever, but telehealth. But on the other hand, we do miss out on a lot of data, as Peter was suggesting.
So, second point that I kind of want to talk about is how generally, when we go into therapy and our clients come to us into therapy, it's because you're in some kind of distress, and hopefully that stress is being lessened and resolved over time. But if you're under stress to start with, and then suddenly a pandemic rears its head, that's not likely to make you less stressed. So our clients are probably oftentimes under a great deal more stress than before. And one of the things that Bob and I were kind of kicking around is how this type of a global experience can recapitulate or resonate with prior trauma. And so this is really complicated, I think, the clinical picture, as many of you, I'm sure know this,
Sure.
Can address. I
wanted to give a very dramatic example I've given to Peter. I worked with a person who was very, very severely traumatized by both parents in childhood, violently. And when he I was urging him to take his first vaccine shot, and he did. And during the meeting, he went into sobs, which I couldn't understand. He was crying now he had the shot. And he said he was crying because he had the realization that the pandemic was his childhood. Secret, breathe the wrong way, who knows, danger everywhere. So this is a very dramatic, powerful to me example of how the pandemic triggers, in such a powerful way, every human being, but certainly people who are severely traumatized get triggered more powerfully.
A third point we talked about is how the faltering economy has affected all of us in different ways. Some people have lost their jobs or have family members who have lost their jobs. Some of our clients may have lost or reduced income. So how do we maintain, service to them? Sometimes, we may have to cut our fees, and of course that cuts our income, and it affects us directly in that way. So this is new territory, and it constitutes an additional complication and certainly stressor for us.
I want to add with that, we have no idea. Are you going to be talking about the future in a second? You probably will.
Yep. Well, yep.
Let me get to that, because
okay. Talk about the future, yeah. Because I think that's probably our place where we wanted to kind of end with before we opened up for questions, because that I think is the most challenging part of what we're facing, is how to predict or how to anticipate, what we're looking at. So one of the final points is that I think for many of us, this pandemic has touched us very personally and up close. This is an existential threat to people's lives, and there are hundreds of thousands of deaths just in our country that we've had to deal with. Many, many, many families have been impacted directly by this. So again, as we all know, losses in the present resonate oftentimes with losses in the past. And that becomes, very difficult, again, for us personally, as well as our families and our clients. The other part that I wanted to kind of address too is that we are also under kind of what I see as a very tragic polarization culturally in terms of our discussion of values and politics. Certainly that's not the area we want to get into right now. But what I have seen in families is that oftentimes at this moment where we really need our connectedness with family and friends, those connections sometimes are being disrupted because of differing political beliefs or different orientations. So that's another, I think, complication that has driven wedges between people at a time when we are probably most hungry for connection.
Yes, Peter, I want to follow with some comments about the future. I don't think we have any idea, obviously, what's going to happen. This is a time-worn phrase. You drop a pebble in the water, the ripples go out in many directions. And I think this is what we're in for here. To cite a couple of examples of large-scale events that affected the world and how they affected mental health. The field of clinical psychology started as a result of World War I and II. 1 million males were mobilized and had to be tested for IQ, a very large sample, and that's how testing began in World War I. Rather, World War II, veterans were coming back with all sorts of PTSD, and there were not enough psychiatrists to treat them, and that began the field of the movement to have other disciplines working for mental health. Field of clinical psychology and as a psychotherapy medium started then. So what will come out of this? My organization, Peter and I, the American Psychological Associations, asked for $1 billion from Congress towards mental health training, which we're going to need. My prediction, and Peter's, I think if I speak for you, is we're going to need all the help we can get. We're trainers, so we know what the needs. We have some sense of what the needs are. So I won't go on.
Yeah. So needless to say, I think the demand for our service is really going to, many of us who are in private practice now know how much it's increased. Many people are full up and have waiting lists, sometimes for the first time. So to move on to the—
I want to add one more concept, compassion fatigue. One of our adjunct faculty has coined this term, and it's about having difficulty, continually needing to find compassion when you yourself as a clinician are struggling, and people need lots of help. One of the other byproducts of this. Sorry, Peter.
No, that's perfect, because that leads into our next session in terms of how COVID has impacted our self-care. And compassion fatigue certainly is something we probably all have experienced. And this is one of the things we're going to talk about a little later in terms of how to draw better boundaries for ourselves and our own self-care, how to say no sometimes, what to say yes to, what to say no to. We really have had kind of multiple hazards to our self-care in terms of just physically sitting in front of a computer for hours, many of us do. It gives us reduced opportunity for physical exercise. And I don't know about you guys, but I haven't even been very good at using the opportunities I have for physical exercise. We have reduced opportunities for socialization with our peers, with our families, with our friends to some degree. And that varies, of course, depending upon the spikes in the virus. And many of us have found that we have a tendency to overuse certain coping mechanisms like alcohol, like food, like shopping, etc. And so those are things that, again, kind of are sort of hazards to our own self-care. So I want to get into how we can basically build our own self-care capacity. And one of the first things that I noticed when COVID hit is that I had a whole, I'm working from home 24 hours a day, 5 days a week. And that was weird. I'd never done that before. And one of the things that I did right off the bat is I pretended that I was going to go into work every day. I try to keep the same routine that I have normally had for the past 10 years working at Nova. And I would put on the same clothes, et cetera. And instead of going out the door, I'd go upstairs to the office and start working. I try to keep a reasonable schedule. Now that hasn't been so easy for me. And I think many of you may have experienced this too, that the idea of having a lunch break suddenly becomes rather nebulous and difficult to enforce. Many times you're jumping from meeting to meeting or client to client. And if you have 10 or 15 minutes to grab a sandwich, you're thankful. It's not like, you're going to go out with a buddy for lunch like I would oftentimes do when I was in the office at Nova. So those kind of boundary and routine kind of issues are very challenging. And now that many of us are phasing back into in-person work, some of you will be, some of you won't be, then it's also another adjustment on how to handle a hybrid situation where I might go to work 2 days a week and be home 3 days a week, those kind of things. I don't know if you have anything.
I'm sorry. One of the things I wanted to add about what Peter's saying about routine is one thing that I find helpful is to find things that I'm doing that I can control. As Peter was saying, a routine gives you a certain control, at least a bit, to offset the helpless feelings that are accompanying the pandemic. So even being able to control one's own schedule gives us control in a sea of lack of control and chaos.
Sure. So some of the things that I touched on before is the importance of physical exercise, which most of us as mental health practitioners preach, but I'm not so sure how many of us practice, me being one of them. And so that's something I think we got to keep in mind. I think also on the plus side of this crazy 2.5 years is that we may have discovered some opportunities to rediscover parts of our lives that we've neglected. Things like hobbies. Behind me, I've got a guitar there that I had not touched for many, many years. And I found myself having some time to do that, during the pandemic, because I'm not driving a half hour to work and back from work and all that time. So that's one of the things that I think we, as clinicians for ourselves, as well as for our patients, we can't minimize the impact of this aversive environment that we're in, but we also can look for that silver lining and see what are some of the things, what are some of the possibilities, some of the opportunities that this kind of crisis, may offer us.
Yes. Yeah, I rediscovered my drum set. So yes, the things that give you pleasure and you develop into your routine. And again, I want to underscore there's such a sense of hopelessness and helplessness with the people we see, and having something you can believe in and that you can do and accomplish makes a tremendous difference.
For sure. For sure.
I had something else on my list.
Mm-hmm.
Oh, practice gratitude. I'm not quite sure why I said that. I mean, it's a great idea. Yeah.
Yeah, and that goes back to the silver lining and the glass being, half empty or full.
And obviously staying connected. We're in a field where much of what we do is building a relationship and maintaining a relationship. And as Peter said, we're not so great at following our own advice, staying connected to others. I don't know if you've had this experience, Peter. I've had former students contact me out of the blue, and they just wanted to hear my voice and be connected to me again, which shows the deep craving. And it also shows what's coming down the pike, I think, in terms of the needs that we're going to have, the needs that the culture, the people that we're going to have. Sorry.
Fine. Along that same line, all of us know, of course, the benefits of mindfulness and relaxation and meditation. How often do we help our clients or patients through this and not do it for ourselves. And again, I have been guilty of that too. So to kind of put something into practice here, to practice what we're preaching, I'm going to walk you through about a 5-minute guided imagery meditation that is really focused on your self-care as a clinician or as a clinician in training or as a person who's not a mental health provider. So the intention of this self-care meditation, and first off, let me acknowledge the author of this, and I've adapted a little bit, is a lady by the name of Katie Kramitsos, and Dr. Emily Caproni, my daughter, also assisted me with shaping this up for our presentation today. So the intention is to give us a space to practice and commit to caring for ourselves, to help you create boundaries, to say no, to say yes, and do the things that make you feel nourished and cared for. So let's begin by getting into a comfortable position. Try to sit straight, maybe put your feet flat on the ground. You might want to lay down or even move in a safe and relaxing way. If you can, close your eyes and take a deep breath in. And as you exhale, allow yourself to sink deeper into your position. Simply be here with your breathing for a little bit of time, feeling your body expand as you breathe in and contract as you breathe out. Breathe in and breathe out. Know that you are worthy of receiving care from yourself. You are worthy of being your priority. You are worthy of receiving the care and appreciation that you so easily give to others. You are worthy of enjoying this self-care meditation. Breathe that in, allowing yourself to be open to receiving your own self-caring. So imagine with me that you're sitting in the middle of a large open room of a house. There's bright sunlight illuminating the room and warming your skin. There's a soft, soothing aroma that makes you feel calm and safe. It's quiet, and the only noises you hear are the songs of nature coming in from the open windows. Even though this large open room may not resemble your current residence, you know that this is your home, where your heart, your body, and your soul feel grounded and vibrant and safe. Breathe into this self-care meditation. Here in this room, you can listen. You can listen to what your inner voice is telling you. Breathe in and breathe out. What do you need right now? What would make your body feel good? What would make your soul feel good? What would make your mind feel good? Just take a minute to sit with your breath and with the answers that come up for you. Begin to see these answers in your mind and watch yourself stand up and move towards the door of the room. You know that you deserve to feel good. You know that you deserve to shine. Open the door and see those things you have called to mind, waiting there for you, ready for you to call them in. Take in a deep breath of gratitude. And one by one, invite in each of these things that you have identified, each of these things that you know will make you feel good in body, mind, and soul. There is no judgment on what you invited in. Maybe you invited in new boundaries you need to put in place to protect your energy. Maybe you invited in the permission to say no. Maybe the permission to say yes. Or maybe even something that seems lavish. But it's all okay because you're worthy of it all. So take a deep breath in and see yourself in the middle of this room again, surrounded by all the things you have thought about to show yourself love, to care for the phenomenal person that you are. You are worthy of this self-care meditation. See yourself look into a mirror on the wall as you place your hands together in front of your heart. See your reflection as you bow your head to your hands. Let the light inside of you recognize the light inside of you. Breathe in and breathe out. So the sense of self-care that you have gotten from this brief practice is something you can repeat at any time. You can share with clients or family members. Very important, especially in these difficult, challenging times, to remember to take care of ourselves in these ways. So that's enough preaching. So there are a couple other things we wanted to touch upon before we opened up for questions. And that is that in terms of building our self-care capacity, for many of us, we went through a training, psychotherapy as students or at different times in our lives. And this perhaps is a good time for us to revisit our own personal therapy. So that's something to kind of keep in mind. And for some of us who, if we have grown up with a spiritual tradition that resonates with us as adults, this may also be something that we can kind of become closer to and reacquainted to. This will help to give us, again, some support moving forward. So that kind of moves us to the last part, and that is how to maintain an optimistic perspective with the situation we have at hand. Since Bob has so much more experience and wisdom on this than me, I'm going to turn this over to him.
Well, well, optimism and hopefulness. You know, every person is different. People with very severe traumas, the man I mentioned before, I give him an image to hold in his head, which centers around his saying, "I'm alive." And he's optimistic that he can do that without being triggered. You know, I'm certainly hoping for much more for him. than merely being alive. But for now, that's what he feels he can accomplish, just to remind himself that he exists and he has a right to exist. For others, it's much more complex. For me, during the pandemic, one of the things I did was I decided to pull together a second book that I'd been having in my head for years, and I was able to accomplish it and get it published. And, you know, for me, I had something to show for it. But that's a dramatic example, and I certainly annoyed everyone in my family by being locked up a lot of the time. But each person has to come to what goals, what wishes, what plans they have. Each person, as Pollyannish as this may sound, I apologize in advance, each person has a certain amount of greatness in them, whatever their definition of great. And when one achieves that, it's wonderful. The danger, of course, with the pandemic is it sidetracked people. And what they have instead of feelings of greatness often is regrets. And regret is the poison of optimism and greatness. Regret, I should have, I could have, why didn't I? It's not a road that one should go down at a time like this. So I don't know if any of that answered your questions. You're used to my babbling. You can tell me if it made any sense. To maintain a sense of hopefulness about the human condition and the belief in humans. You know, Peter and I were talking before this meeting, and I said, I know there are some people who are not good people, but I think that's rare. The older I get, the more I realize that most people want to connect and want to do the right thing, particularly in our professions, call it the helping professions for a reason. They want to connect, they want to do well, they want to do good. You know, the yin and the yang, every time you want to do good, there is the other danger they call moral injury. There's a concept now from the pandemic called moral injury, that we have not fulfilled our desire to be helpful. We've had the thought, I wish this person would leave me alone. It's too much work, what do I do? And even there, one needs a space to hold that and accept those feelings, as you heard in Peter's meditation, to hold those feelings and tolerate them and recognize that's part of the human condition. Did I answer anything?
You touched on a lot of good points, and it reminded me of something I just read in terms of a list of affirmations for uncertain times. And one of them is, I release the need to be productive. I allow myself to adjust day by day.
I'm going to practice that one.
What that boils down to for me is that I oftentimes am very impatient with myself, that I can't do what I could do before. And that's frustrating. And it also, for those of us who've got too much of a superego, you know, we feel like we're being bad, that we're not doing the right thing. And kind of related to what you were talking about earlier in terms of the moral issue. So I think we have to always remind ourselves that we do the best we can under the circumstances here, and that it's not going to be 100%. It's not going to be as good as it would be if we weren't under this type of stress.
Right.
Yeah. There's a couple other points I wanted to mention, and then I'd really like to open up for questions, so we have plenty of time to, you know, bring in perspectives from you guys. Some of the things that most of you already know, but I want to remind you, again, for yourself as well as your clients, is the idea of a growth mindset versus a fixed mindset. And again, this relates to what we were just talking about. Do we see our lack of productivity as a failure, or is it something that we can learn from and grow from and accept and move forward from? There's also the fairly recent concept of post-traumatic growth. And this is the idea that as debilitating and as damaging a trauma can be, and certainly we don't want to minimize to our clients or to ourselves, the pain and suffering that go with these kind of trauma. There is a possibility of moving through the trauma into a space in life that in some way is productive. I was just with one of the parents from the Sandy Hook shooting, and I was absolutely blown away by the social and emotional learning program that she has put together, and that she is basically taking to schools all over the country to try to make schools safer and less violence prone, so that what happened to her 6-year-old boy won't happen, hopefully to another person's child. So those kind of things I think we need to hold on to, and not in a Pollyannish way, but there are things we can control. There are things we can do. It kind of goes back in one sense to what our friends at Alcoholics Anonymous tell us in terms of the serenity prayer. Have the courage to change what you can, accept what you can't, and try to figure out how to tell the darn difference.
I want to say two other things. Peter will be too modest to tell you that he was a consultant during the Parkland shooting, and also recently with the Surfside tragedy in Miami, and learned plenty, I think, from working with the healthcare, with people who were on the front lines and people helping. I also want to say that one of the things we didn't talk about, and I just noticed one of the people on this are talking about resilience, and I think what we'll see, as we've always seen in doing this work with people who have been very, very traumatized, is the shock and awe about resilience. The human spirit, as we see from, I don't know if any of you are familiar with the book by Viktor Frankl about his time at Auschwitz. The name of the book is now escaping me. It's
Man's Search for Me,
Man's
my
Search for Me.
favorite.
Yes, yeah. And here what we see is what we're going to see more and more of soon: the amazing resilience of the human spirit.
Mhm.
Peter?
Yeah, I think Carlos is telling us that it would be a good time to turn to questions. So Haley, I think our wonderful graduate student from NSU College of Psychology is here to help us with that.
Okay, so I have your first question here is Telus psychology here to stay?
I'll start. Yes, absolutely yes. Not just for the reasons of necessity or convenience, but there have been certain advantages of being able to work with a family. I mentioned briefly before, I have several families where the kids are at college in various places, and the families in a great distress, crisis, impending divorce, and we're able to meet, adjusting with the time zone. One is in the Pacific Coast and one's here where I'm in New York, and it's in Florida. So that alone is going to revolutionize the work we've done. Then you also have, again, the convenience for some people, who can't travel. And, so yes, just on those alone, there will be, and calling it a meeting very quickly with people in different geographies. We've done, and we can do that. Peter?
I would agree with you on that, Bob. I think the probably practice is going to look very much like a hybrid practice.
Hybrid, yeah.
Many of our clinicians that I talk to now are already doing. And it also is a way of individualizing the delivery of our therapy, of our support services in a way that's optimum for the clients. Some people actually do prefer, doing it this way as opposed to in person. Some people absolutely want to be in person. So again, it's that preference that we have to look at. Remember, APA tells us, the evidence-based practice of psychology, really, we have to take into account what the preference and expectation of our clients are.
I'm hybrid now. Are you, Peter?
Yeah.
Yeah. Other questions, Haley?
Okay, so the next question here, what are some good examples of good boundaries we can set to protect our emotional health for ourselves and our clients?
Thoughts, Peter?
I'm thinking to some of my mistakes that I've made in terms
where
of
I was
making
going.
myself too available.
Yeah, that's great minds think alike. That's, yep.
Yeah, I think we have to be cautious in terms of whether we use email, whether we use text, whether we use phone calls, and how we use them with different clients. Some clients don't have any difficulty with boundaries in terms of not calling us, at odd times or expecting us to be available 24 hours a day. Some of our clients, by virtue of their difficulties, have not developed those kind of boundaries yet, and we have to be able to help them on that and to be more strict in terms of not responding to a text at 11:30 at night when a client sees a TV show that really inspired them and they want to share that with us.
I want to add that while we're talking from the viewpoint of helping the clinician, the idea that somebody who gets an impulse to speak to their therapist at 11:30 at night and that they can isn't really good for that person either. The world doesn't work this way. Exactly. So it's not just about our own needs. In this case, it's about good practice.
Yeah.
Thoughts?
So I have another question here from an attendee. He's saying that his experience with the pandemic has been that when he's normally with a client pre-pandemic times, that he can see that the problems he experiences are different to what the client is bringing in, and he was able to experience empathy in a different way. But now the pandemic, everyone is experiencing that. So he's wondering if you have also experienced that and how that has impacted empathy with your clients.
I'd like to take that first. Yes, it is true that everyone is experiencing the same difficulties, but not everyone is reacting in the same way. And the way one reacts to the pandemic it has to do with who they are and what their dynamics are and their character structure and their traumatic history. So that, in a million years, I can't imagine, whether I was a therapist or not, seeing something on television that triggered or struck me as interesting and wanting to bother my therapist at 11:30 at night. That just wouldn't be me. Maybe to a fault, it wouldn't be me. I have maybe the opposite tendency. But the example is that, that person is triggered because they're having the same experience as I am, but they're acting in different ways. They're triggered in different ways. Different things trigger them. So I think, yes, it's true. I think one can be empathic about how the person is sharing with the same awful situations we're in. But we want to create a space for understanding how to make meaning out of how they're acting differently, or how they're feeling differently, or how their experience is different, even if they have the same experience. I don't know if I said that clearly.
And I would want to add to that, I would agree with all that you've said so far, Bob, but I would also say that there are many, many different experiences of this pandemic, depending upon a person's life circumstances. So it sort of reminds me of one of the challenges we have as clinicians in terms of countertransfer. I'm Italian American, and I might assume that I'm sitting with a new client who's Italian American, and I'm going to understand better maybe what their experience is. Well, maybe not. When I worked in South Philly, I worked with Italian Americans who were from a different part of Italy than I was and who came to this country at a different time than my family did.
That's
So
great.
my assumptions were totally wrong in terms of my being able to empathize. I had to throw them out and start from the beginning. So I think that general principle also applies here. We may assume we know what a person has experienced in the pandemic because of various similarities. Those could be more superficial, and we have to sit back, dig a little deeper, and listen, in terms of really understanding how they've experienced this.
Right.
Okay. So this next one is also from an attendee. She's asking if you have any self-care advice for those who have not had a change in work, if they work at a hospital or a corrections, for example, and they've not gone virtual, and they haven't had the time at home to practice self-care, and they're feeling stressed that they might even consider leaving healthcare.
What a great question. And I think for those of you who do fall into this category, you've had probably one of the most difficult assignments of all of us. We've relied on you as a society to take care of us, and you haven't had the option of working from home. So I think at some point in time, you may need, again, to explore personal therapy to see what your next step could be.
Or counseling, or if not personal therapy, counseling.
And one of the things that can be helpful is to use your experience now to make decisions about where you want to head in life. These kind of experiences oftentimes have people go back to school to explore something that they maybe like, but went off in a different direction. Or if you want to stay in healthcare or corrections, to figure out a way to change what your work environment is like. Is there that capacity, that flexibility to find something that may meet your needs better?
But for the now, I agree with everything Peter said and underscore it. We had an anecdote. Some person applied to our doctoral program, and we asked her about clinical experience, and she said she was a stewardess of a certain airline. And she was actually right, but not in the right way. That what they're encountering now is distress. But even for people who are in this now, I want to urge you, because I've worked with people in this circumstance, to reach out to your colleagues and stay connected to friends. And on the drive home, call a friend, the same friend you worked with yesterday on a shift or whatever. Don't forget to stay connected to people in this same boat. They call it a gallows humor, or sharing the unfortunate words, but that to know you're not alone, and that others of us may not understand it, but the people you worked with on yesterday's shift do. That's, I think, life-saving.
And Bob, there's research to back this up in terms of the idea of post-traumatic growth. Interestingly, one of the strongest predictors of positive outcomes was what you just said, and that is maintaining close contact with a support group that has experienced the same type of aversive or traumatic experience that you have. Absolutely.
Okay. And this attendee asks, how do you get self-help and set time aside for that self-help when you have something else that's directing your time away from you, such as she says she just has a child that was just diagnosed with autism who needs her. For something like that, where you have multiple different things kind of taking at your time, what do you suggest?
Yeah, the situation you described there of having a child with some very, very high level needs makes it really difficult to cut out some time for yourself and to take care of your own self-care. That's where it really helps to have a support network of folks that maybe can give you a few minutes of respite here and there, or to have a program where your child can be a part of. We have a program like that at NSU. I don't know if you're in the area, but that's something that you certainly can contact me later about if you would like. But again, the idea that you're absolutely right. Your time is you're operating 110% now, so you got to figure out a way to get a little help and to get a respite in there where you can have the time to take a breath and take care of yourself.
I would say some variation of, I agree with Peter, we agree about a lot of things. I would say a variation on the thing I said before, the issue I mentioned. Now you're part of being part of a club you may not want to have been a member of, but there are other people who are using the same support services that you are, and they have groups, they have probably virtual now, groups and people who are also involved with whatever facility you're connected to, or if you're not, then I think you should seek out to get support, because you're going to need, after this pandemic, you're going to need connection with others who can help through the life cycle. So more than ever, I underscore finding compatriots who are in the same situation through the organization that you're, the help groups that you're using.
Absolutely.
This person is working clinically with frontline workers who have been traumatized working on COVID units and ICUs. What suggestions do you have to cope with the vicarious trauma?
I want to go back to the issue we talked about, moral injury. That there's a whole understanding now of people who are under this questionnaires of care, who are filled with guilt and doubt and self-reproach about who's alive, who's not alive, what decisions they've had to make, and the impact of those. And I think it's impossible, maybe not impossible, it's very difficult not to also have the therapist who's treating these clients feel the same way, to deal with the moral injury and also feel a kind of reciprocal moral injury. I wish I could help this person, or look what they're living with, etc. I would point to Viktor Frankl's book, Man's Search for Meaning, to read yourself for help with a very, very difficult situation.
And I would agree 100%. And I think I would just add that I think our problem-solving approach or perspective as mental health practitioners sort of leaves us hanging when we're in these situations, because these are problems we can't solve. These are experiences that are devastating. So I think in some of these situations, the best we can do is, in Joni Mitchell's words from Woodstock, may I walk beside you. May I walk beside you.
Yeah. Really, it's true.
Okay. Does the issue of helplessness that has been a byproduct of the pandemic add to the urgency of your clients' complaints?
Peter?
I think, yeah, I'm trying to make sure
I have some
understand.
notes. That's why I was looking at the notes, because I did write about that. All right, I'll do this.
Okay.
Yes, absolutely right. And one of my suggestions is to see if you can find things that in your life, in your work, in activities you enjoy, whatever you can, that will give you some sense of control, so you can help communicate that to the people you work with who are not having a sense of control, who are feeling absolutely helpless. And I think that's key. I think all of us feel helpless about the pandemic and what it's done and how it has controlled our existence for over 2 years. So it's crucial that the therapists themselves can feel some sense of control over some aspects of one's life, so we're not saying falsely to someone, yes, you need to get control over yourself, because we need to get control over ourselves. So I don't think I said that well, but yes, the answer is yes.
Mhm.
He-
No, I think that's what I would say too. I was just reading a question from Andy Rosen. Thank you, Andy, for
Hi, Andy.
another Adelphi graduate.
Yes, hi, Andy.
And you're asking an interesting question, and that is that it's one thing to empathize with a client or patient when we're not experiencing the level of depression or anxiety or helplessness or whatever that they are. However, this puts us into a more of a difficult situation when we are experiencing elements that our client is experiencing, like helplessness or depression or anxiety or whatever it is. So I think it's a different kind of challenge for us, but it's the same challenge that happens when a client walks in who has experienced something in their life similar to us.
That's correct.
So how do we handle that when that comes in? We have to, reflect on our countertransference, what our reactions are, what's being triggered in us, and be, consciously aware of that, and to be able to partition that away from, interfering with the client. But in sometimes it may help us empathize also. And I think for me, the fact that we do have this commonality now, we can use that to our advantage in terms of building the therapeutic relationship and empathizing.
I concur. I think that there are, even if we're experiencing the same traumas as we had talked about before, we may be dealing with them in different ways. And how the person is dealing with them, different from us or the same as us, has to do with their characteristic ways of dealing with things, or in other words, one's personality. And so in part of making meaning out of what the person's doing and how they're struggling with it, we learn about them, and maybe we can help. We may not be able to help by telling them to do the things that we're doing that don't apply to us, but we can at least look for certain, what gives me a sense of resilience, what makes me feel hopeless about my life, and what makes me feel hopeful about my life, and what can I do differently. So my eyes were flashing on a question. Can I mention that one? The person says, my attention and concentration during sessions have gone way down with Zoom and phone sessions. Any tricks to keep myself on track? I think it's a great question.
It is.
I had been taking very few notes prior to COVID. I am back to not taking extensive notes, because that would distract me just as much. But I'm back to having a sheet ready for every person I see with date and name and date, and I take some notes. And if I have nothing that I've written, I then think to myself, what am I not doing? That has helped me. I guess it's giving me my own, I'm a college professor, giving me my own quizzes. I give myself a quiz.
Bob, you and I have more similarities than I realized. Yeah, prior to COVID, I would write a note that was probably a fourth of a page at the most. Frequently now, I'll write a page and a half for a session. And that helps me stay focused.
Right.
Yeah.
It's a trick. I mean, it's working for me. I hope it can be helpful.
Well, folks, it looks like we're getting close to our time. Carlos, do we have time for another question, or we need to start to wrap up?
Last question.
Okay.
Please talk more about how the pandemic can recapitulate past traumas.
Peter, that was your phrase, and I think it's wonderful. You want to do it?
Yeah.
I'll jump in.
And I think this is where, again, losses in particular, we can deal with them. We can, at our particular developmental level, we can put them to bed. They cannot give us symptoms and problems. But then things happen developmentally, maybe sometimes, or with another loss that causes us to open up that wound again. And we have to take experience it again, feel those painful feelings, and put them in, to integrate them, to put them together in a way that makes sense for us at that present point in time. So I think this type of a huge global aversive experience has tremendous potential to do exactly that, to reawaken, to resonate with these past trauma.
I want to give an example of what Peter was saying that I gave before about the man who I tell to close his eyes and think of the phrase, "I'm alive." If you remember back, it seems like a year ago to the last beginning of today, when I talked about the man getting the COVID shot and that he then went into sobs saying that he realized now that he could feel safe enough to realize it, the COVID shot was giving him the belief that he might be able to survive, that he was saying literally what Peter had proposed, that the COVID itself felt like his horrible childhood, his horrible, dangerous, frightening childhood. So you can't get a more dramatic example than that literally recapitulated the feeling that he was in danger of dying at any minute. Now, not everybody has such an extreme reaction, but not everybody had a history like his. And not everybody with a history like his has the resilience he has, which is what has one side issue result of what's happened is I'm just incredibly impressed with the resilience of humans. So Peter, this has been great. I mean, the topic's tough, but we got to work together again, which is wonderful.
It's been delightful.
Yep.
And I so much appreciate Carlos and NSU and Adelphi giving us the opportunity to do this.
And all your questions, thank you so much. This was wonderful.
Thank you both, and thank you all for joining.